We are live.
Okay. Hello, folks, and good evening. It's 10th of October, and it's every 10th of month. Nina Malhotra, the chairperson of the Imaging Science Committee, I'm committed to the Gyan Pravah, the brainchild initiative of our dear President, Dr. Sunita Tendulkar. It's indeed a pleasure and honor to welcome Dr. Sunita Tendulkar. Welcome, Sunita, for this live podcast, and thank you so very much for joining.
Hi.
Despite her trip from Figo, Cape Town, her passion is unparalleled, and she's right here, sharp at 8 o'clock, committed.
Thank you, Nina.
To,
Thank
so
you, Nina.
let's have Sunita welcome us, our speaker.
Thank you, Nina. And I also appreciate your efforts that today is Karwa Chauth. And I know in North India, it is so difficult for you to take out any of the faculty. And I'm so glad that you are doing it so beautifully. And you got someone to talk on mental health, which is so important topic. For your information, we do have one publication this time is on the mental health at perimenopausal age. Dr. Jaideep Malhotra and Priya Gupta are mainly the lead in that. But I'm so glad that we are today with this beautiful Purnima. Thank you so much, and I'm looking forward to hear you all from the viewers link.
Thank you so much. Yes. Thank you, Sunita. Thank you so much.
Thank you. Enjoy your podcast. My voice has gone, but I will listen to you, madam, from the other link.
Yes, of
Thank
course.
you.
Yes.
Thank you for coming on a Foxy
Not at
platform.
all. It's indeed a pleasure. And may I add that it's also World Mental Health Day today. So
Ah,
it is indeed a special day.
thank you. Bye.
Thank you so much. Thank you. So I think my dear, guest on the podcast has already given. I thought I'll keep a suspense and ask my viewers, what is 10th of October? So I'm sure everybody would jump and say it's Karwa Chauth. And I thought maybe somebody would say it's a celebrity's birthday. But I think, as Dr. Arvinder Singh points out, it is World Mental Health Day. So, my dear colleagues, friends, doctors, patients, and many, many viewers, welcome to this podcast. And let me have the pleasure of introducing my very, very celebrated speaker and the guest today is none other than Dr. Arvinder J. Singh. She is the director and the lead of the mental health program at the prestigious University Ashoka in Sonipat. And she has, to her claim, experience of working in the UK, India, and a vivid, diaspora where she's handled patients, an excellent psychologist who has done many of those who have been troubled with mental health and given them a ray of hope. So welcome, Dr. Arvinder, to our podcast today.
Thank you very much, Dr. Malhotra. Thank you for inviting me and having me over.
And as we go on to say, our theme today is Mind Matters in Motherhood, understanding the perinatal mental health, understanding perinatal mental health. So, I think as doctors, be it any specialty, but particularly as obstetricians and gynecologists, we are focusing so much on the physical well-being. Every time a pregnant woman comes to us, all of us are kind of ticking our boxes. Well, is the hemoglobin good? Is the blood pressure fine? What about our scans? But I think there's something very important, and that is the emotional well-being of the mother, which we today on the mental health do accept that it is probably being missed. And how relevant is mental health? I think pregnancy and mental health are very much linked. Mental health can influence not just the bonding, the way a mother breastfeeds, but eventually the long-term child development. And I think to understand it better, we have Dr. Arvinder Singh, who's a lead mental health expert who specializes in the emotional health of women. So welcome to our podcast, and thank you very much, despite being the Karwa Chauth, and I think probably this is your third live, show of the day that you are being. So I think let's begin with understanding, our women better. Why I know the theme is mental health during pregnancy, but I think let's go before pregnancy. In today's day and age, where the dynamics of the society have changed, where women are moving and taking their career pursuits to a greater heights, nuclear families, and when couples are kind of planning pregnancy with women pushing their childbearing beyond 30, 35, which was not the norm, I would say, 10 years back. What you feel are the reasons? You think are these the reasons? How do you think women? How do you see women when they sort of seek advice, or in general, on the anxiety scales as they look towards motherhood or their pregnancy or pre-pregnancy planning?
It's a great question. I think, right at the outset, you put the context that there is a change, there is a shift in at many levels. One, what does motherhood mean to women today compared to what it was 30 years, 25 years back? What are the change in dynamics? I think what has happened is that women now are also focusing on their careers a lot more than they were doing 30 years back. So the role norms have shifted, which also sort of, comes in the way of when you want to get married and when do you want to get pregnant, when do you want to have a child, and then who is ready to take on that break to sort of take care of the child, because I mean the joint families are very few and far between. So there are no caregivers for the newborn infant so that the mother can go back to work. So who does that, who takes care of it? And with all of this, I think the anxiety has had, and post COVID, I must say that, the anxiety spaces have really, I mean, the way it shows up has changed because there's a lot more. I mean, it wouldn't be very far-fetched to say that, now if somebody really coughs in your face, you have a different kind of response than what it was 20 years back when it didn't even matter. Every other child was coughing. But um, so people are more anxious now, and with that, what has happened is that the women, particularly because of anxiety, and as a gynac as well, the fact that it interferes even with conception. So even when people plan their babies, and the fact that when you cannot have them, then the IVF, and I think there's another layer to it. I mean, I believe now people are also choosing the donor sperm with the qualities and with, it's no longer just a Hollywood movie, but it's really happening as well. So I think all of that really complicates the whole, the so-called very natural, organic process of being a mother. So and I think even for men it has changed a lot. So there is a lot of shift, and there is a lot of planning around it, and therefore there's a lot of anxiety. And also now, if we see from, if since you mentioned 10 years back, from 10 years back to now, the level of mental health problems has also changed. So, I mean, if we really look at it among, the figures among women, like 20% of the women will have some kind of anxiety, depression kind of states that are there in that, perinatal kind of stage. So you're right, when we look at all the hemoglobin and everything, are we looking at the demographic of the mother? Are we looking at the mental and emotional state? We're also looking at many abusive marriages where there is very little or no protection, where people are thinking this child will cement the marriage. So there are layers and layers and layers of it, which has actually, what it's done is that it's had a tremendous amount of impact on the fetal growth, on maternal blood pressure, on the state of being, on the level of cortisol, and the fact that depending on the level of cortisol of the mother, there is research and evidence which also shows how it impacts that of the child as well. So, if you see, the whole landscape of what it means has shifted. And the fact that many more of us are showing signs of depressions, of anxiety, also changes and adds another layer of complexity to motherhood and perinatal care. So that's really the state of sector right now, if I may say.
And you truly pointed out. I think we can't forget that the social media, that's another, you know, trajectory that which we feel which was not there so much of Instagram or whatever, Facebook. So I think that also has a bearing where people are kind of watching and kind of looking at things too. How do you see that aspect when women are planning? Or do you think, yeah, it is like, yeah, we
Yeah,
just heard you.
pretty much so. The way the media shows how beautiful, how lovely, how exciting it is, and something that, you're very happy, fulfilling, and it's a beautiful phase. But I'm afraid, to burst that bubble, it's not like that for everybody, So women who feel, there is pressure, there's work, there are deadlines, there are home situations, there may be a sick parent, there may be a dysfunctionality in the family, there may be so many other things. Or the fact that, so all of that, or the natural anxiety, right? I'm being a late mother. Do I need to do all the tests? Will my baby be normal? The natural things that a mother goes through. So can you imagine that something that you see on social media or you're even socialized, your mother, everybody will say, oh, it's a beautiful face. I mean, it's not all very beautiful and all very happy and all the time very fulfilling. So when a woman starts to feel anxious or low or even overwhelmed with all of that, she may end up feeling very guilty also, or very afraid to bring it up with anyone because it doesn't fit this ideal, beautiful narrative of motherhood as as is shown. So, so that's why I think, and maybe, the woman is also in many caregiver roles, and she's not able to really look after herself as well. So that really changes, her own narrative, and there is a lot of confusion and overwhelm. I mean, I know I've been a mother, and when a friend of mine, wanted to be a mother, and with her partner, and she wasn't married and all that, and I said, please do be prepared that there is a lot that you will have to contend with on a day-to-day basis. It's not all very beautiful and rosy. And when the baby was born, and I went to meet her, this she's always very well turned out and all of it, and suddenly I see her really low and depressed because her body doesn't look the same, and there's a baby in her arms that's wailing and crying, and because she has these ideas from the social media that she's picked up, that everything has to be very in a certain way. The child is crying, you don't give them anything, you let the child cry. And it took all my skill set to really convince her to see that here is a child that's really crying. This is more of a trauma for the child than the
Right.
fact that you're bargaining with the idea of, I don't want to give this and I don't want to give that. Whatever be the reaction, but to think that the child will soothe itself. And also, if I may say, with all due respect to all other cultures, that a lot of, we are sort of discarding the wisdom of our own culture and trying to adopt things from the West, which may not necessarily be required in the Indian context because we have a lot of support. So your child doesn't have to cry and soothe itself because there'll always be someone, a parent, a grandparent, a nanny. Luckily, somebody will be there to help the child to really not cry. And again, all these things have such a bearing on the emotional well-being, not just of the mother but also of the child, the unborn child, and the child that's to be born. I mean, we've all laughed at, oh, when I see a certain movie, the child kicks in my belly, right? I mean, we've all had stories of the child kicked, or when I saw this, when I ate that. So you know that whatever is happening in your external environment is having an impact on your unborn baby as well. And there is, I mean, it's not a very well documented research, but there's enough evidence on the fact that if the mother's had a very anxious or a very low mood pregnancy, it has an impact on the emotional regulation of the child as well.
Yeah.
And other issues as well, but of course with the emotional regulation as well.
Yeah. So, what we've got people who are, caring for pregnant mothers who are in government setups or maybe in private hospitals or the corporate. I think we are all aware that, we are looking at the well-being of the mother and the baby. We call it mortality figures, morbidity figures, government scales. We are like scaling up our resources so that all these figures are showing a very brighter side. But I think somewhere the perimental health picture is still very invisible or it's rather blurred. So, do you think this issue is unrecognized or underrecognized? And how do you perceive this? And what do you think are the reasons? And do you think can we change the mindset of the treating doctors and say, look, this is important and relevant? How do you foresee this? And how do you think you can sort of uh, give your thoughts and views on, improving the idea that obstetrician doctors should put a lot of stress on the mental health of the woman or the mother when she's, pregnant right from the first
Yeah.
to the last trimester of pregnancy.
Yeah, yeah. I think, what happens is that with our doctors, I think, first of all, I must acknowledge that the pressures are immense, And of course, as medical doctors, the focus tends to be on the clinical safety. And mental health concerns may not be seen as urgent because they're not so visible as well. So the primary concern is physical complications. And also, many doctors may feel that they don't have the time or the tools or the right language, to address the kind of emotional distress that their patient may be going through. So if you really see, it's like a systemic blind spot, where everybody's trying to do their best, whatever it is, where but this emotional layer is missing. So I think what we really need to look at, if we are looking at how do we address this, I mean, I would say that, first of all, the change has to be at a structural level. I mean, I'd say it at every talk. I mean, at the previous talks in the day also, I said that, we have to integrate the mental health screening and a basic counseling routine into the antenatal care as well. So when a pregnant mother comes, we don't we can include a very simple emotional well-being check, like how's your mood, or or make some kind of check-ins or stuff like that. Just to try to see, are you feeling very angry these days? Do you feel low, disturbed, depressed? Because if we really like any other problem or any other disease or any other illness or any other you know, issue, concern, early intervention is really the key. So, if in the early months we find that the mother is looking low or sad or depressed or tired all the time, low energy, these are all signs, very basic signs of possibly a low mood, or a mood disorder or a depression. So, the thing to do would be, if a doctor, while talking to the patient about their, like to your point, the hemoglobin, the blood pressure, the scans, also says, how are you doing? How is your mood? So in this trimester, what have been the high points, low points? It literally takes two or three or four questions, which can be integrated. So at a structural level, I think this can be done, because it's like really, and it's going to make a huge difference, because it's like kind of also, we could build a collaborative care model where, the psychologist is also involved. So when the mother's coming to a doctor, there's a quick visit to the psychologist also, or a psychiatrist if there is need. Because that, from the doctor's end, when it comes, it normalizes talking about, that mental health is a part of the obs care and it's not separate from it. So, what I'm talking about is integrating. I'm not saying have separate units. I mean, where required, yes. But okay, AIMS may have something like that, but other hospitals, smaller setups, will not have that kind of facility. And this is at a structural level. So, what happens is that it builds an acceptance among people. Just like, see how it's accepted everywhere, every village, every woman that gets pregnant knows about iron and folic acid. That's all thanks to the awareness building that's been done. And structurally, it's been there. So now women are, even A&M will know about it, even a midwife will know about it, and she'll say, Dawa khalo. So at the second is, I think, the mindset. And I don't mean it's first and second like that, but two at the same level. The structural change and the mindset level change. Because we still feel, we don't see emotional health as important. But if you really see culturally, our ancient wisdom would always say, ke maa ko khush rakho. Pregnant mother ko, she should be kept happy. She should not be stressed out. And now that's really changed, simply because the joint family is not there to provide that kind of love and support, where your elders would indulge you in your cravings. And, now it's a lot more practical. And I'm not saying it's not there, it's much lesser. But when we support a to be mother's well being, I think we are also improving her ability to connect or bond with her baby, to breastfeed effectively. I mean, there is so much that, depending on the state of mind, the milk in the breast is also, it's not just dependent on what you eat, but also what your mental state is. So, and also her own body recovers physically. And also it may contribute to preventing other issues like postpartum depression and stuff like that, if the mother, if we built in that kind of care. So both the structural level and the mindset level, the change has to happen.
So, we can just simply put it, a happy mother will bring forth a happy baby and a happy family. That's important.
Yes, in a nutshell.
Right. So I think we'll move further. So as you rightly pointed, like you talk to your mother, just try to ask the pregnant woman, how are you doing? How has been the day? And how do you feel? And truly, but could you say that when we are like in busy clinics, even though we are, having fewer patients, but we are sort of so, I would say meander around her test or her pregnancy and whatever measurements we see. Do you think you could suggest some kind of validated tools or something which should say alarm us or tell us, no, look, this mother needs a special care? Because all of us do not have a psychologist in our sort of clinics.
Yeah.
So do you think there are something, yeah, I must say the alert signs or something when I say, yeah, this is not just anxiety, it could be depression, it could be, or because we don't have time enough to talk to know their, social backgrounds, their
Yeah.
family setups, and a lot of thing goes under the carpet, which is like uncovered in this life. So do you think there are some warning things that we should all be, as doctors, knowing and take it
Good.
further?
Yes, yes. I think we could be the gatekeepers as well in this. When we are able to look at some kind of signs and symptoms that would be there, very obviously, if there is a very extreme switch in mood, if either that the mother is very low and sad, that's very obvious. But if you find that in checkups, you're finding this mother's mood is really yo-yo. She goes from being very excited to very, very low. That could be a sign of some kind of imbalances that may be kicking a mood disorder. Or if the mother is so anxious that there are several questions, one after the other, there's a lot of reading up happening, there's a lot of questions, whereas there's a healthy curiosity, which is very much appreciated. But there could be sometimes other issues that, if a mother's continuously, if you find a mother's coming to you continuously asking too many questions, she could be going through an emotional turmoil wherein she has her fears and she is trying to cover those through this cover is through these several questions so that nothing goes wrong, or the fact that things that come naturally to us, they may become a very big issue. Sometimes I find that things that very basic things that you don't really need to fly by the doctor every time. Very anxious mothers tend to really do that as well. So, if a doctor really sees signs of extreme mood swings or very low mood, very persistent low energy, really haranguing the doctor with too many questions and too much, information and really nitpicking about everything, these could be signs of some kind of distress. There could be mothers who, in their low mood, might show complete disinterest or even not show some basic hygiene. Sometimes, in extreme cases, they don't even look after their hygiene. Or a mother, a person that is usually well turned out, suddenly you find them looking very, shabby, or you find that there is a behavior where you find like just a glazed eyes, where they're like out of touch of reality sort of. All these are signs that of mental distress, and I think this does not require any major educational qualification, or you don't really need to go to a psychologist or psychiatrist, but just by looking, and asking, is everything all right? Are you okay? Or asking basic questions of, uh, what month are you in? What can she recall? What's her memory like? What injections have you had? So that to see how aware or alert is she. Because there is, of course, there's a lot of abuse of medicines and substance these days. So you don't know what's happening, and that can have an impact. And just to really find out whether there is any kind of, recreational substance being used or something like that. Those are all indicators that will tell you that if it's either a sign of mental health issue or it's developing towards that. So if we can really, or just asking how stressful is your work life, like what does your day look like? How many hours of work do you do? What kind of stresses does your work have? That'll give you some sense of what kind of cortisol levels maybe she may be dealing with. And then just helping her or connecting her with either counseling services or just saying talk to someone. or normalizing, saying, look, or if a person is feeling very anxious, try and tell her that, look, it's very normal to feel anxious. But this anxiety is, if you feel it's going off the charts, here is a counselor, you can go to them or talk to someone because this can impact you. So let's just take care of it. Or simple practices of mindfulness or deep breathing, those are things that they can even research on the net and find out for them what could be calming, what could be good nutrition. All of that has a bearing on their mental health. But basically, these signs of really swinging behaviors, very low mood, persistent anxiety, a glazed look in the eye, maybe the conversation is disconnected, all these are signs that there could be mental health concerns.
I think you've really brought up one important point. I think that's where I feel that we need to focus. As you already said, that the anxiety levels are there too much on the question mode. And I think they're not satisfied. The answers don't seem to, the
Yeah,
answers that they are seeking. And I think that's when you go around and you do pick up, there are something like personal relationship issues with either their husbands or their spouses or whatever. And I think at the workplace also, I think this is something which you rightly point, maybe we tend to wait them off. But I think this is something where we need to identify that there's something more beneath the surface.
absolutely.
So I think you really put you've really set the ball rolling for us to understand that beyond our routine iron, folic acid, or whatever we do, we have to kind of understand this because we want this mother to be not just be happy, but be healthy mentally as we want her. Now, I know at a tertiary hospital like AIMS, we're very privileged. We have right from their bookings, right early in pregnancy, we have a multidisciplinary team. We have a set of counselors with they not be trained psychiatrists or psychologists coming, but within our systems, we have trained our people, our nurses. So we do the breastfeeding classes, we've got yoga, we tell them meditation right from the 24 weeks, and of course, do a tours for the birthing room and all those things. But this may not be the ideal norm, in a setup which is, what we generally see. So how do you think that we can sort of work together with the mental health professionals and, can we have something like we see, yeah, we can create kind of in bits and maybe look to a model of healthcare which a woman deserves in pregnancy. How do you foresee that?
Yeah, I think the way forward is capacity building, and not just capacity building, but like kind of culture building. Like where it's a culture to talk about it, where it's like it's a very nice point that you brought up about how people are going for and both parents are going for the prenatal classes and the birthing classes and all of that. Just as we've adapted to that, I think we need to adapt also to having sessions on emotional wellness. And in that kind of, we can even do capacity building within the resources. Yes, of course, hospitals like AIMS have the services, but even for very small town places, I think just investing in some kind of psychosocial screening, some kind of, training in empathetic communication. At an institution level, hospitals can develop linkages, with either mental health professionals, even if it's not on site, maybe online, maybe telecounseling, maybe collaborations, maybe, like sessions like that, where this becomes an important part. The second way we can build capacities, just like, the staff has been trained. I mean, we can't expect the doctor to do all, right? So, but just like the other staff, the nurses and other staff has been trained into talking about meditation, talking about other things, or even the doctor talks the same way, just a very simple skill set of how to communicate with empathy, how to really just ask the person how they're doing, can be integrated very easily. I mean, I'm not saying that let's just do this such and such test and all of that on them to see what their levels are, but just as a basic level, just create a human connect. End of the day, when you have a child inside your body, it is very natural. Your body becomes very different. So your own connection with your body is different. Quite literally, your center of gravity is shaken, you know, as physically also and emotionally also. Emotionally, you're thinking about the child. Everything is about, the world is different. Whereas before you had the child, if you went out to the market, you'd be looking at clothes for yourself. Typically, the moment a woman gets pregnant, all she can see is baby clothes and baby cribs and baby. So your universe is also shifted and tilted. Now, somebody needs to really, and of course, with that will come your fears, your anxieties, any trepidations. So, somebody needs to say, this is normal. Just like when you waddle around, the good doctor tells you it's okay. Your body is a different shape, you will waddle, you won't be able to sleep, so put a pillow. Same way, why can't we tell them it's normal to have your emotions going in a yo-yo? Because you're going to be a mother, the hormones are fluctuating, they create so much of a havoc in your body. Some days you're going to feel happy, sometimes you're going to be scared. What is helpful is talk to someone. Talk to someone about it. It's normal, but don't keep it inside. And once you acknowledge the emotions, somebody talks you through it, you feel better. So if we control them at the stress level, then they don't become a distress or a crisis. And that's a very simple thing to do. It's a basic training, probably not even half a day training. And people can actually then turn around and, be able to do things in a way that is more positive and more fruitful for them. So that's what I would say, culture building and capacity building, both. Like, we have to have a culture where we think that this is important, and it's not floof. It's not like, oh, just physical things need to be done. But systemically, let's just integrate it with, why can't we ask, how are you doing?
Good, you're really bringing out some interesting thoughts and putting us to really think. Again, mental health in India is a stigma. I'm sure you won't accept that.
Of
Also,
course.
once there is a mother to be, or for that matter, during postnatal depression, of course, it's a gender norm which is there, which we have, but women are not able to express themselves. How do you see that the partners or the family could also be taken into, account, and they could also be involved? Do you think, yeah, it is a mother only who needs to have her therapy, but how do you see this, overall a support system where we need to navigate these cultural barriers? Because even if she has a mother-in-law come in or somebody, because you're living in a nuclear family, and suddenly that shift may precipitate women who are prone to depression. So how do you see, you as psychologist or psychotherapist, would you help them receive the kind of psychological support, not just individually but as a family? So how do you see that?
I think, first of all, I think it's a great question to bring. It's a great thought to bring because, especially in our country, in India, you will see, and I'm talking about the masses, I'm not just talking about the elite, the masses where there'll be more than one family member that accompanies the pregnant mother. And many a times, and the doctor here is a very important figure because everybody listens to the doctor. And it's literally the doctor's orders, as we say. So, if the doctor normalizes or makes, the emotional well being a very standard parameter of maternal care, then it just has to be. So when that happens, then we don't treat symptoms in isolation, but we truly support the woman as a whole, mind and body together. So for that, I think, if with the family we could just talk about how important it is and involve them. Essentially, when the family members are coming in, what they really want is they want to be involved in the child care, in, they so make it very collaborative. And I found that even in mental health practices, so if you collaborate with the caregivers and make them feel important and make them feel that they are actually very crucial in making this pregnant mother feel one, two, three, four, and that you appreciate that, that's all it takes, just a sense of human connection. And so treat not just the pregnant mother, but for you, your patients are like the two other people also, or three other people that have come with them, So I think that that's important that you break them so that, because, the thing is that in some communities, this kind of hormonal, whatever, distress or emotional distress is still brushed off as normal. Hai, kuch nahi hai, focus on the baby, be strong. And there's also the guilt that, that like you're supposed to feel happy because you're expecting. So normalizing and saying that it's normal to feel anxious and that you can make a difference in that. So if the family members are involved in that, I think it just creates very, a ripple effect. And I think what is important is for the clinicians really to to create a very safe and a validating space, where all these feelings are allowed to come, and therefore helping the family members to see this as an important part of so-called having a healthy baby. When a grandmother comes, she's very invested in the grandchild that's going to come in the world. So to be able to say that for your grandkid, it's important that this body that is bearing that grandkid is taken care of. So these are some of the things that you could do, and only you can make sure, so, and there is, and allow it without any feeling of shame or any feeling of guilt, or labeling. So, but just simple questions when with the pregnant mother, ask her, how have you been feeling emotionally these days? Or even to sort of say, look, pregnancy can bring a lot of changes. What's been the hardest thing for you of late? That just allows her to speak, and with the family, of course, normalize and destigmatize. When a doctor says it's normal to feel all this, maximum the mothers will say, हमारे ज़माने में तो नहीं होता था. It never happened when we were doing. To which all of you doctors know that, look, now things are very different. Earlier, most women were giving birth in their homes. Now there are very few and far between. So when we reduce the stigma, we open the door for a dialogue and for, so we need to be actually mindful of the family and the social dynamics, because it involves the family, the partner, and I think helping them understand that emotional health is a part of the medical care and the so-called treatment or whatever, that can make the process much more acceptable and smoother, perhaps. So because it reduces the stigma. And I think lastly, I would also say that, we also have to be culturally sensitive. We have to meet people where they are. They're not going to change their beliefs overnight. But if we approach every patient, every family member with some kind of empathy, some kind of respect, we can gently, very slowly shift the conversation, which sort of maybe is something wrong there, you deserve support, so we can validate some of those emotions in a very gentle way. So it's not a very brusque thing, but also not having to judge, but make it inclusive, make people, everybody, every family member, every mother, the mother who's bearing the child, to make her feel important, and of course with the grandparents and other family members, to sort of connect with what is good for them, not to judge and say, why are you worried about the unborn child, you must really worry about the mother, but just to say, yes, how exciting, you're going to get a grandkid, so let's ensure that this vessel that is carrying your grandkid is also very well looked after. I mean, I know some people can jump and say, what is this kind of speak, but I think I believe very strongly in meeting people where they are. We don't have to change them necessarily, but we have to speak a language that sort of matches their cultural language.
Certainly, I think podcasts like this, I don't know, there'll be viewers which will be hearing because the theme is catchy. And I think the Federation of Obs and Gynae Societies of India, Foxy, for through which we are doing this podcast, I think is definitely a platform and an organization which is giving us opportunity. And of course, being attached to academic institutions. So how do you think could be the way forward? Or do you think there's some alignment in which, bodies like this would take things better? Or do you think can we have means to increase awareness, not amongst just the few learned ones, but across health caregivers, not just obstetricians in the metros, but across? Do you think you see any way we could sort of sensitize
I
doctors and
think,
health caregivers in small
yeah,
towns as well?
yeah, yeah. I think that, Foxy has a big role in it. And I think podcasts like this, Gyan Pravah, can actually be, because that's what it's saying, Gyan Pravah, can actually be platforms where something like what we are doing today, I'm hoping that this contributes a little bit to seeing the wider perspective. Maybe if even a few doctors really resonate with this, it becomes a ripple effect, because each time, suppose you start doing that with your patients and you see an impact, you can talk about it to the others and the others and the others. Behavior change is never overnight, but behavior change does happen. That is something that I'm very sure of. And I think, Foxy can actually be a very strong advocate and contribute to building awareness, especially with your national reach. I mean, you can normalize the message that, you know, mental health of the mothers, or maternal mental health, is actually maternal health. The mental health is a very integral part. I mean, Foxy can have campaigns, conferences, continuing education for all the doctors. All of this goes a long way because we're really looking like at a culture shift. And to bring that culture shift, the advocacy, the trainings, the more podcasts like this, more awareness building, more normalizing these conversations, because you're the torch bearers. So when you start talking, many other, smaller organizations or conglomerates of doctors will start talking in smaller cities as well. So this conversation about emotional and mental health becomes very normal. I mean, we normally do ask each other, "Oh, how are you?" But let's just very genuinely ask a pregnant mother, how is she feeling? Does she sometimes feel low? Is she unable to sleep at night? Does she sometimes worry? You know, and to normalize and say these are very normal things that a pregnant mother goes through, but there is help available for that. Pretty much like, when your belly becomes too big and you can't lie on the side, the doctor tells you to, put a pillow under your knee or under your stomach. Very small little things, but they give a temporary relief. Similarly, why can't we talk about that, your emotions are also going to be yo-yo when this happens? So take it as normal, and these are some of the things that you can do.
Yeah. So I must say thank you so very much, Dr. Singh, for you sharing these valuable insights. I think today's discussion reminds us that, a healthy mother is not just one who is physically fit, but someone who is emotionally supported. And I think you really brought the spotlight saying that at Foxy and tertiary hospitals like or academic institutions like AIMS can always take the lead and bring about what is called a holistic healthcare for a woman. We should integrate mental health into not just the routine obstetric care, but make it as a priority. And that's a priority area. So to all our listeners, I think we should just take a pledge today on this World Mental Health Day to listen a little more. I think ask them a little deeper, and also this way we can give them a better care, widening our horizons to sort of not just the hemoglobin and the likes. So thank you very much, Dr. Singh, for joining us on this Foxy podcast. Now, I think we would really look forward to the kind of, deliberation that we've had. And maybe, we can have you as an expert to our CMEs and upcoming, sessions on women wellness, which is not just about her healthy body, but also about her mind, spirit, and keeping our mothers healthy. Thank you very much. Thank you very much
Thanks a
once
lot.
again.
It would be an honor and a privilege to be a part of this. Thank you for inviting me. And to everybody who's joined this podcast and will be seeing it at any time, do know that you can make a difference in someone's life. And especially when we are talking about an unborn child, a newborn baby, do know that your behavior, your smile, your support can actually build trust in that child. Can actually, because in the first year, how the child is held can also make such a difference. So and knowing that a woman's body goes through changes so many times, whether it's menarche, pregnancy, perimenopause, menopause, and so much more, do know that it deserves all the love and care that you can. So go ahead and spread that cheer. Thank you very much.
Thank you. Thank you very much. Good night. Bye.
Good night.